Hi, Grandma. This week I'll be talking about E. coli diseases. So, E. coli is a bacterium that lives in our intestines and the intestines of other animals. Most types of E. coli are harmless, but there are certain types that can cause illnesses. And these types that cause illnesses are grouped according to the way they make us sick. So there's this type of E. coli called enterotoxigenic E. coli, or just ETEC. And these types of E. coli produce special toxins which stimulate the lining of our intestines and cause them to secrete extra fluid, which results in watery diarrhea. In addition to diarrhea, they can also cause fever, chills, nausea, abdominal pain, and or headaches. Um, Another type of E. coli is the enterohemorrhagic E. coli, or just EHEC. And as the name suggests, these type of E. coli also produce toxins, but these toxins are different from the ones produced by the ETEC in that they cause bloody diarrhea. They can also cause fever, abdominal pain, nausea, and vomiting. So, diarrhea does not always lead to dehydration. But when it does not lead to dehydration, there are three main rules as to how to treat it at home. The first major rule is to make sure that the patient is receiving plenty of fluids. So, if the sick infant is exclusively breastfed, what the mom can do is breastfeed a little longer than usual, or she can also give to the infant oral rehydration salt solutions or clean water. If the infant is non-exclusively breastfed, the mom can, in addition to those salt solutions and clean water, the mom can also give them food-based fluids such as soups, for example. The second rule is to make sure that the sick infant has an age-appropriate diet. So by the age of 6 months, this infant should have energy-rich complementary food in his diet, and should be given these types of this energy-rich food at least 3 times a day if he's being breastfed, or at least 5 times a day if he's not being breastfed. If the infant is between 1 and 2 years old, this is where family food needs to be introduced in his diet. So these types of food will differ by culture and setting, and of course the types of food that's available. When this infant is 2 years of age and older, nutritious snacks should be added to his diet at least twice a day. The third rule is to know when to take the child back to the hospital. If the child is not getting better in 5 days, or they develop bloody stools, or they're not breastfeeding or drinking properly, they should be taken back to the hospital. When diarrhea does lead to dehydration, the mostly recommended treatment is oral rehydration salt solutions. Now, this treatment usually lasts 4 hours and is done at a healthcare setting where the mother is taught how to give these solutions to the sick infant. However, sometimes during this treatment, the infant may vomit. And when that does happen, what the mom has to do is take a 10 minutes break where she does not give the kid any solution, any salt solution. And after the 10 minutes, she can resume treatment, but slowly, meaning that instead of giving a teaspoon every minute, she can give it every 2 or 3 minutes. That's all I had this week, Grandma. Bye.